I am extremely grateful to Health Asia, Professor Azimuddin, for providing me this opportunity. So, contents, I'll talk about some ambulance, availability of facility, budgets, radiology and emergency, and then about something about JPMC. So, let me begin with that emergency work began with shifting of patients from the site of incidents to ambulance and then to a medical facility. Patients can be of any age, sex, pediatric, neonatal. It can be trauma, cardiac, stroke, vascular, obstetric, and each has its own needs and response time. Mass emergencies, natural disasters, radioactive contamination need special arrangements. We are blessed to have a large number of charitable organizations serving in healthcare, and many of them are operating ambulance services. These ambulances are of great help for patients' transport, but otherwise at present these are not equipped as per international standard. Many even lack the first aid kit and the oxygen cylinder. Some of the private and public sector are improving to international standards, but the numbers are not enough to meet the need of the city, province, country, nor covering all aspects, like we don't have air ambulance service in general. International standard has very compliant chassis for the ambulance. It should be climate controlled, should have defibrillator, qualified EMTs, PPE, crash protection for the vehicle, infection control measures. In Pakistan, actually, we mostly have this type of ambulance. 112 service is improving in every province. Virtually, we don't have we only have 2-3 air ambulances in the country. Most of our transport ambulances that are for stable patients need basic stretcher, first aid kit, oxygen cylinder, a trained driver and a basic attendant. But emergency ambulance should have a proper equipment like defibrillator, cardiac monitor, suction, ventilator, IV, set drugs, and paramedics, and even in some cases you need a doctor, and of course a GPS communication. But when it comes to the cost and the maintenance, naturally it's a very high-end, high cost. Operational cost is very high, so that's probably the main reason that we don't have that facility widely available in the country. If I talk about Sindh, we are around 55.7 million people, and as per international standard, there should be one emergency ambulance for 50,000 and normal one for 100,000. So this is covered by charitable organization, but this emergency ambulances, at present, the 112 has tremendously improved in the last 2-3 years. They have only 260. And this government of Sindh still need to work on this to improve that. And the major gap is in the rural districts. Emergency service in the Sindh, prior to that, there were few organizations offering ambulance service, but at a large scale, it was introduced by Aman in 2009. Unfortunately, they had to stop their operation in 2020. Patient Aid Foundation managed that for an year in 2022, and then finally the government of Sindh finally approved a bill for the emergency rescue service in 2023, and they started their operation in 2022. It's a great facility. It's a unified service implemented with the help of World Bank. It's a one-window 1122 operation, and it is at present operational in the 6 districts of the 6 divisions of the Sindh. I was just looking at their data. It's a very good number since inception in 2022. So far, they have managed around 744,000 emergencies. That's a good number, and I think if they improve on their number of ambulances, they can further improve on that. Even in larger tertiary care hospital, we always have a challenge of availability of a critical care bed, and ideally there should be every DHQ level hospital should have a critical care bed, 9 for trauma, 6 for cardiac, and 15 for general ailments. Unfortunately, at present we don't have this facility at most of the DHQ or even tertiary care, so-called tertiary care hospitals. Why these facilities are not available? Then its main reason is, one of the main reason is the budget. So naturally, in public sector, tertiary care hospital has high patient volume, limited diagnostic resources. Most of the emergency bays are under-equipped. They are non-functional equipment. They have expensive equipment, but due to lack of maintenance, agreements, these are not operational. There's a shortage of trained radiologists, technologists, especially in evening and night shift. That is a great limitation in public sector. Just for, it's just a small comparison. You see, UK has a 68.3 million population, right? And we are at 240 million people. Their annual health budget is 180 billion pounds, right? And in Pakistan, if we include budget of Punjab, Sindh, KPK, Balochistan, it is 1,500 billion rupees. That comes to around 4 billion pounds. You see, so there is a wide gap when we start comparing Pakistan with the developed world. So we should also keep this thing in mind. The 180 billion for 68 million and 4 billion for 240 billion. That's the actual amount which is available. Worldwide or in UK, the per capita is $5,467. In Pakistan, it's $48. Developed world usually spend 9 to 10% on the health. In developing world, most of the countries, they are spending 0.8 to 3%. After devolution, the provincial governments are trying to spend more on the health, like government of Sindh is spending around 9 to 10% of their budget on the health. Solution, like with this availability of budget, I don't think that we can see any dramatic change in the near future. Solution is NGOs, mostly public-private partnership are, centers do not have facility of X-ray, ultrasound, whereas the worldwide, the people are getting the facility of bedside CT, MR, and this is mainly because of non-availability of the budget. On the other side, the government of Sindh at least has done some good work. They have developed chest pain unit for cardiac patient emergencies through NICVD and Sindh Institute of Cardiovascular Diseases. There is another very good example of managing emergency. There is an NGO with the name of Child Aid Foundation. They are running some emergencies in almost in all provinces, but I have some data about the Sindh. Government of Sindh is also planning to upgrade all the emergencies in the Sindh. The budget has been approved. I think it is still in pipeline when to implement that. 1122 is also constructing emergency center along the highways. So I'll just share that this child emergency service is working, or their model is that they adopt, renovate, operate public sector ERs. At present, they are only working for the children emergencies. The impact is that the mortality, which was very high, has reduced to 1.2 to 1.4%. Previously, it was actually very huge. This is a reference I could find on the website that University of California, they did a study on Civil Hospital Karachi and Sheikh Zayed, Larkana. These are 2 emergencies out of that 14 or 20 which they are running, and the mortality has reduced to, infant mortality has reduced to 1.2%. So solution is public-private partnership. It will not be possible to run these facilities with the government funding. Coming to radiology, no doubt radiology allows quick knowledge-invasive examination, crucial in emergency situation, real-time decision-making, help physician to make immediate decision regarding the patient's treatment plan, minimizing risk and complication, identify life-threatening conditions, timely preventing unnecessary delay and complications, also help to reduce the need for more invasive procedure by providing accurate, quick results. As per these various standards, the emergency area should be at least 20-25 meters clear. It should be close to the main emergency. It should have all these facilities like oxygen suction, monitor, defibrillator, controlled HVC, power backup in developing countries. It is also very important to have a power backup generator, UPS systems. At least in the proposed plan for the emergency upgradation by the government of Sindh, they have agreed that they will provide X-ray, color Doppler, C-arm, and a dedicated CT scanners for the emergencies. It's still not included, but our objective is that we should have PACS installed in all these systems. There should be availability of 24/7 availability of a staff radiologist, technologist, or at least online availability of the radiologist, and a staff of radiology technicians who are serving in emergency should have BLS, ACLS workshops. Naturally, each modality has its own advantages, disadvantages. I'll not go into the detail of that. I'll just skip the slide. Two things I want to stress that I think at JPMC emergency, we receive around 2,200 patients. There is an ultrasound facility available, X-ray facility available, but the number of patients is such a huge that it will not be possible to manage all that patient with timely diagnosis. So I feel that we should train the emergency physicians, qualified emergency physicians on this fast. So that will, I don't think these emergency physicians should replace their, say, stethoscope with this ultrasound. So it will help to improve, it will improve their diagnostic capability also, and it will lighten the burden of the radiologist also, and overall survival of the patient. Secondly, I don't see availability of C-arms in many centers, and people are still reducing fractures without the C-arm coverage. So this is another modality that should be available. Sorry. So C-arm, I think it should be considered essential in all emergencies, especially wherever you are managing the orthopedic. Innovation can help. Telemedicine, teleradiology, if we cannot provide a 24/7 radiologist at site, at least through telemedicine, teleradiology, that can be managed. AI intelligence, I mean, there are different opinions about that, but I think that AI should be considered to assist radiologists in detecting fracture, hemorrhages, and other conditions for more quick response. Portable imaging, advances in CT, scanner, ultrasound devices, access to imaging in trauma-based remote assessments, that should also be considered in future. One slide I share at Radiology Resident Forum also, that radiology is no more a diagnostic field. Your reports save life, and you either save life or you sign out death. I learned this in my professional life and want to pass this on. Before giving a conclusion, stop for a second and think, if this patient was my child, mother, father, brother, sister, or dear one, what would I have done? Trust my words, this will save many lives. If you don't have time, you have a very busy practice, start donating these few seconds just to please Almighty Allah. This will save life and bring blessing to your life also. Coming to JPMC, receive a largest number of RTA on almost every celebration. Up to 1,000 patients of head injuries are received at JPMC emergency. Of course, we also receive large number of victims of assault and others. Most of these cases are critical, need immediate attention. Number of patients are progressively increasing. Night, evening shifts are always overcrowded. This is a one video. Ye chalegi bhai video? So just look at this counter, right? Timing jo hai.
Sir, 5 minutes are left.
Okay, blast at 17:59, 50 second. ये blast हुआ है JPMC में 2 February 2010. 17 died, 37 injured, and 18:59 after say 1 minute, in 1 minute 9 seconds, facility restarted. इसी emergency में when all these patients were managed. So that is the spirit of our very dedicated workers of healthcare in Pakistan. I don't think that you will find this type of courage in any other part of the world. Another, we always criticize the government about non-availability of the facilities, but I just want to share a cost analysis. When a patient reported emergency, undergoes, usko pehle PG या CMO देखता है, then there is a second opinion from subspecialty. Always get a free lab test. X-ray, ultrasound, ECG is always done. If need, stitches, that is also managed, and always get some injection, drip, vaccination, etc. As a safe guesstimate, at any private center, it will cost at least 10,000 rupees. Certainly much more, but at least 10,000 rupees. So I'll come to the deep generosity of the citizens of Karachi, that this year in January, मुझे पता था इस दफ़ा अजीम साहब जो है एमरजेंसी पे रखेंगे, तो जनवरी का हमने टारगेट रखा था कि यार हम जिन्ना में एमरजेंसी टावर बनाएंगे, ठीक है. So on a lighter note, so alhamdulillah, the people of Karachi has transformed JPMC. Many ने transform किया, people of citizens of Karachi. We have built this surgical tower, this food complex, this medical tower, and employees wing are under construction. Funds are available. We will hopefully inaugurate this next year. This neurology and stroke section is also completed. Hopefully, very soon, Lutfi was here. We'll start the stroke services at JPMC in this section. This is our new project, JPMC Emergency Tower. It's a 12-story tower with a parking plaza, and the cost of this project is around 12 billion rupees. Every year JPMC entertain 6-7 lakh patients, right? So I firmly believe once this new section is operational, we will be treating around 1 million patients a year. So 1 million patients a year with 10,000 rupees mean 10 billion rupees. 10 billion rupees. The cost of this project is, new building is, say 12 billion rupees. Annual 1 million patient, 10,000 mean will be, so we also do perform free surgeries, right? So if we include the number of surgery, we'll be providing free services of 12 billion rupees, and the recovery or the value for money will be recovered in a 1 year's time. And then trillions of patients will be benefited. The citizens of Karachi are very generous. They have provided the construction cost, that is around $20 billion. The government of Sindh has pledged to provide the funds for the equipment. So this will be connected with the parking plaza. This building will also be connected with the existing emergency tower. It will have after every emergency, there is a large number of bureaucrats, politicians who come for a photo shoot, right? So in this building, we have planned that all the critical patients will be placed directly or scanned or examined on the first floor, so that people for these photo shoot can come and manage or have their photos on the ground floor. So alhamdulillah, the citizens of Karachi, some of these names are here, has provided, pledged for this amount, project, and inshallah, Allah's willing, in 3 months' time we'll begin the construction of this, and in 30 months we'll complete this project. Radiology save life, reduce treatment delay. Investing in radiology means investing in patient survival. Future direction, filmless X-ray image transfer directly by Wi-Fi. Wi-Fi se bhi kafi, I feel that if we have this in JPMC, it will further improve the efficiency. AI for emergency reporting, educate emergency physician on fast. To have a fast track growth in public sector, we should encourage public-private partnerships at all levels in Sindh and other provinces. Thank you very much.